My name is Karen Peterson. I am the founder and chief patient advocate of Karen's Club. Thank you so much for joining me tonight, everyone from all over. I really appreciate you guys for tuning in and checking in on the second installment of the webinar series. Yay! And it's about missed opportunities, the social barriers. And we have here with us the honor of having Dr. Marya Shegog, Equity Health Coordinator at Lazarex Cancer Foundation. I'm so proud and so humbled to have her with us today to talk about the social barriers that keep some of us from participating in clinical trials. And so before we begin today's event, I wanted to talk a little bit about my background because they said, "Oh, Karen, you don't talk about your background. People are not everybody knows who you are." So for those who don't know who I am, my name is Karen Peterson. I was diagnosed with stage 4 triple negative breast cancer in 2017. My original team didn't value my voice. It was a sad situation. I had to walk away from them. I was looking for a clinical trial. I was looking to make an informed decision based off science. I found a second opinion, was able to backdoor my way into the clinical trial. I had a 4% chance of survival, and the very first scan came back really good. And I've been cancer free now since 2019. So I feel like, thank you very much. Somebody clap, named Rick. I appreciate that. I just feel like Karen's Club is a beautiful way to give back, to help educate and inform patients about the options of clinical trial. I formed the organization with my partner, Nava Friedman, and we're not recruiters. We're not trying to walk people into trials, but we're trying to empower people and give people information because a lot of times you can't make an informed decision unless you have all the information on the table. And so that's what Karen Club is trying to do, is trying to bridge the gap between the researchers, the clinical trials, the patients of color in the community, and make sure that everybody's just having an open and honest conversation about what's actually going on. So now that you know my story, let's talk about a little housekeeping. So the rules are in Karen's Club that everybody's going to be on mute. That doesn't mean that you don't have a voice, because I believe in voices. You can all chat it up in the chat down below. You can ask questions. You can comment on what's going on. In addition to that, if you have any trouble, you can always reach out to Nava in the chat, and Tia, our guest tech support. Thank you, Tia. And lastly, for anyone who wants to continue the conversation, please feel free to go on karensclub.org and you can get a one-on-one consultation with a patient advocate who's actually been through a clinical trial and who can actually speak to the experience and answer questions in a confidential setting. So let's go. Before we begin with the questions, I think I better let Dr. Shegog introduce herself and talk a little about her background before we get into the question and answer session. Hi, Dr. Shegog. Nice to see you. Thanks for
Hi,
being here.
Karen. Thank you. It's nice to see you as well, and it's always good to be seen. Um, so I'm Dr. Marya Shegog. I am the Health Equity and Diversity Coordinator for Lazarex Cancer Foundation. I have a background in public health and community health and wellness, and definitely am passionate about how we can create equity and health across the board, including in cancer and cancer trials. Lazarex Cancer Foundation is a foundation that was dedicated to helping those who otherwise could not participate in who could otherwise not participate in clinical trials, remove some of the barriers so they can participate. Clinical trials are tricky and hard to find and locate, and even more so hard then to be able to bridge the gap. Oftentimes, when there's clinical trials, if you find one that you are matched for, it might be in another town, another state, or really just across town. Going by where you live, that can be a far way away. Um, and so we are dedicated to removing some of those financial toxicities and social barriers so that people can attend and participate in trials. And that in itself will create a larger diversity. What we know about patient trials or clinical trials is that oftentimes they are established, they have established protocols, and they go to established organizations to recruit for their trials. Well, if those organizations, one, require insurance, two, are, in affluent areas or more affluent areas, then it means that oftentimes even the referrals into clinical trials will not include a lot of, BIPOC, people of color, and women, even going by what the instance is. So the real key is to get it diversified. And how do we do that? By making sure that those people have access and removing what our topic is today, some of those. I think there's not a single road to diversifying trials. There's not a single road to having successful cancer care. And I think that's part of the problem. So really removing and creating some of those clear and defined of what is gold standard of care, but also making sure that people who want to or even have interest have access and can make informed decisions is really key as well.
Thank you so much, Doctor, for that introduction. And I had I thought I was thinking back when we first met and we had our a very initial first conversation, and we were talking, and you were telling me about your life and your background. And when we talk about barriers, we always talk about one of the first things is education and it's trust. And then when you think about it, we also, one of the barriers is voices, and voices meaning our voices, especially as people of color. A lot of times it's intimidating, it's difficult to have a conversation. In our culture, we were taught, I know as growing up, it was to be seen and, not heard. You had to respect your elders, you had to respect police officers, doctors, teachers. I come from that culture, and I can remember talking with you. And I can remember you mentioned that you come from a family of doctors, and it was always encouraged in your household, in your family, in your grouping, that to ask questions, to have a voice. And when we think about clinical trials and we think about having the conversation about access to health care and access to, like you said, the gold standard, a lot of times our voice is not heard. It's difficult. I know, I went through it. And it was one of the toughest things, but one of the bravest things that I ever did. And I know what having a voice did for me. But can you talk about that, what that's like, and what that means to have a voice before we even get into the rest of the barriers? What a voice, that voice
So
means.
it's really amazing that you asked that. Like right now, just in the universe we live in right now, I think it's an opportunity. Like we have to learn to be better advocates of our health. If a doctor doesn't answer your question, it's not because he knows. He just may not be able to answer it, or he's not providing you with optimal care. So it's really hard. So I think the distrust comes from many things. One is oftentimes there is a preconceived notion, that idea of medical bias. There's a preconceived notion of who you are and what you're coming with. And so we see time and time again, there's this opportunity where women come and present themselves and they tell the doctor there is something wrong. And the doctor's like, you're too young, or no, you're not a risk factor, or all these other things. That's a problem. And that's really hard because sometimes many of us, going by our insurance, we don't have an option to go to any other doctor. This is our primary care. And so it's even harder. And so one of the things is that bias, that many times, and I'll speak especially Black women because we see it especially
Yes,
in childbirth and
yes,
everything else.
yes,
We
yes.
see that they are dismissed summarily. You're too young. Well, you just need to lose weight. Know your body morphology. All these different things can kind of create this bias that then you feel like you're not being heard. And you're fighting for your life, period. Whether it's because your skin is messed up, or your skin is not where you want it, or because you think you have cancer, you're fighting for the life that you want to live. And if you think of it from that perspective, there's no stupid question. And if the doctor can't answer the question, you need to find somebody who could. So
Right.
it's not the easy being a patient, an advocate, being a great advocate for your own life is not the easiest thing because of all of the things you said, from being, you know, um, taught that your doctor knows best, and so in that, thinking that your doctor knows best, then to question them, it automatically seems as though you're questioning the doctor. And maybe you are. I mean, I do often, so I can't say it's not me, but sometimes it's also just that you're trying to understand,
Right.
and if the doctor can't talk to you in the way you can't understand, then ask the nurse. or get an, ask if you can ask somebody else until you get the understanding the way you need to understand. Sometimes the logo and the lingo is so
Yes.
difficult, and it's so,
Jargony.
the CRT of the BTP. Well,
Yes.
wait.
Yes.
Even when you said, I'm triple negative, if people aren't real versed in breast cancer, they don't know what that
I
means.
didn't know what it was. I had
Right.
no clue.
So when a doctor comes to you, he's like, well, you have breast cancer. We've typed it as triple negative. And then sometimes the doctor makes it too simple. When my mother was diagnosed with breast cancer, they're like, it's estrogen. So my mother's like, wait, the stuff my body produces gave me and it turns into another whirlwind of confusion in your mind. So really learning how to ask questions, even if, I'd rather be undercomfortable and alive than uncomfortable and not than comfortable and not. So you got to push those questions. There's lots of tools out there. There's a couple really interesting places that I can think of, especially when you're navigating cancer, that you can where you can go to learn to find out what questions to ask. And then when it comes to cancer trials, it's even more complex, right?
Yes.
And so luckily there's organizations like Lazarex, where I work, that will help navigate that for you. If a person calls into our organization, and any person can call in, no matter of their financial standing, they can call in and they can say, this is what I have, and they can find out if there are any trials that they may qualify for.
Do you think it's too much to ask as like part of my Christmas list for trust to be like understood by researchers? Because I've been talking about clinical trial diversity since 2019. Not a long time, but long enough. And then it became a really big deal in 2020 because of the pandemic and COVID and right. And so, and when Nav and I were building the site and we were talking to patients, when we were talking to the community, we were having those one-on-one conversations. It's trust, it's trust, it's trust, education, trust and trust and trust. And you look at the articles and research, trust and trust and trust. It's there. Why isn't that? Why is it always like a 30-second soundbite? Why is it that the community as a whole really is not embracing the fact that this is inherent in us, that we don't trust the system, that we are side-eyeing it and wondering whether or not this is actually the information we're getting is truthful, it's reliable, and it's like, why isn't that more?
It's,
Yeah, I just don't understand why they don't
I
they can't
mean,
hold on to it and understand it and have solutions built upon that.
I think it's like basic human nature. Like I'll tell you what, I had a dog who, before I got him as a puppy, he was kicked. Every time he got close to a foot, he already was flinching and to moving out of the way. It's the same thing. So many people have had bad experiences in the healthcare arena. So now they're already flinching. I know you're going to lie to me. I know you're not going to give me the truth. I know so I think that's part of the issue why trust is so hard to come about. And like, I think part of it is the recognition on the side of healthcare providers. So your doctors and clinician realizing that they need to build trust. Just because you have MD in front of your name, or I guess behind your name, just because you have your doctor doesn't mean that I'm automatically going to trust you. And that's something that has to be built. And trust is so nebulous. It is a soundbite now, and nobody has really given definition to it. What does that mean? You know,
Right. In our community, it means a whole lot
it
because it's
does.
the number one thing that comes up next to education. And it's a thing that is not going to disappear anytime soon. And it's something that should be built upon. If we don't trust the system, if this is keeping us from making informed decisions and exercising our right to options and better health care, then why isn't it address? Like, look at it, cradle it, take it apart, have conversations about it, and stop with the 30-second soundbite about history. Yes, we understand history. Yes, we should respect it, but trust is right here and it'll be there tomorrow and the day after and the day after, and it's not going anywhere. And I just feel like it's there. Everyone is talking about it, but no one's really like addressing it in a solutions driven way. And that's what I think the community needs more of, is the solutions in regards to trust.
Stephanie, one of the participants, just suggested maybe starting with the older generations, and then helping them inform the new generations. I think it's a two-way street,
Yes.
right?
Yes.
So I think that both, I think one, going into places where people, one is word of mouth. So one, let's be honest, the healthcare system has done some really bad things to people of color, Native Americans, and all of that, right?
Mm-hmm.
So you have to be able to go back to those communities, and one, I mean, honestly, there needs to be acknowledgement. Yeah, we did some jacked up stuff. There needs to be two, there needs to be a discussion held. And I think it's really important to go to where, and I think Stephanie just, I think it was Stephanie. If it wasn't, please forgive me. Because I'm talking and reading and that can be bad.
Mm-hmm.
But I think, you have to go to where people live, right?
Yes.
So
Yes.
that means, like, I was going to, right before Stephanie said that, I was going to say, you go to the churches, right?
Mm-hmm.
You go to the place, the spiritual, and I'm not saying church, I'm saying you're going to this place of spirituality where people
Mm-hmm.
get their guidance. A lot of times when people get diagnosed with it, with a disease, you know, one place they go is to their house, their houses of worship,
Mm-hmm.
some buoyancy, some, like, give me some strength, and
Right.
also for support.
Right.
And so if the ministers or the reverends or the imams or know about opportunities that might save their life, then that's one place where you can build. And especially, and I mean, honestly, it sounds really crazy, but the healthcare system tore down their trust one person at a time.
Mm.
We're gonna have to rebuild it one person at a time. It's,
Mm.
I mean, before we can get to the community, because if I had a good treatment somewhere, then guess what? I will tell my friends, my family, those I love, this is where you can go to get good treatment. And then they will go based on my word. And then you know what? They have to go and get good treatment.
Right.
Right?
Yeah.
So it's, and then so it's like, just like everybody trusts, um, like, everybody knows at least once, don't squeeze the Charmin. It became known as the soft toilet paper, right?
Mm-hmm.
And everybody now says, oh, well, I know Charmin is soft, right? So you have to build that, almost the brand of healthcare being a place where people of color, you have to build it and keep it and maintain it where people of color can get good, equitable healthcare.
Speaking of healthcare, I was doing a little research before we gathered here today, and in late 2020, the former president signed the Clinical Treatment Act, which federally requires Medicaid to cover routine costs of clinical trials for participants who have that insurance and who have a life-threatening disease such as cancer. The law will go into effect on January 1st, 2022. My question is, do you think this will be an opportunity for big pharma and researchers to say, all right, Medicaid is not fighting us anymore. They are going to pay for participants in clinical trials. Is that an
So,
opportunity to have clinical trials in community-based clinics instead of always
so there's a
going?
couple of things. I will tell you one thing that we found, in meaning Lazarex, what we found in our research is that pharmaceutical companies used the fear of inducements, of being accused of providing inducements to participating, as a reason not to provide um, these kind of access to clinical trials. So between, yes, that clinical trial, and then there was a guidance put out by the Food and Drug Administration discussing inducements and better defining what inducements are. I think it will open up the opportunity, and I think um, there is an acknowledgement that sometimes, well, a couple of things. There's acknowledgement that yes, they can go to places like federally qualified healthcare centers, FQHCs, and then they would have a whole different patient population and probably than what they would have otherwise. And those are, most of the people who go to FQHCs are underinsured, uninsured or underinsured. So it'll provide them access to people, a lot of people who are probably black, brown, and low income people. So that's yes. And so FQHCs are your federally qualified healthcare centers, and they sometimes are called CHS, which are community health centers.
Mm-hmm.
And then also you have rural health centers, and then you have, um, hopefully that'll include the Indian Health Service as well, which is the healthcare services. Because I mean, that's the thing that amazes me. When we talk about it's hard to find Native Americans, we have Indian Health Services. Really, they're on the tribal lands. So it's not that we can't find them; it's that nobody's looking.
Mm.
And not only that, but there's nobody building a bridge from the Indian Health Services to where the actual treatments are. So I think that, especially when we're talking not specifically to cancer, But like when we're talking about things like diabetes, if you want some Native
Mhm.
Americans, some indigenous peoples to participate, guess what? They're not hard to find. We can find them.
And
Um, so I think that there's been a kind of a laziness, if you will.
mm,
That's my word. Um, by the pharmaceutical companies saying, "Oh, that's inducement." Well, now that that's been erased, I hope it does. I also think because of COVID, there's a lot more opportunity for remote trials.
mhm. Mhm.
And really optimizing technology. Um,
Decentralized. Yeah, that's what they're using now. A lot
I
of
mean,
people.
that's what I would love to see. Like, how they have the discs for diabetes measurements,
Mhm.
that you can that are stuck on and you wear them for so long and it helps maintain your blood sugar at a healthy state. What
Mhm.
happens if somebody could get um, their cancer treatment drugs via that disc by program? What happens if there are heart monitors that are that can read all different kinds of things of your body via Wi-Fi and the internet? What happens if we could do that for cancer? What happens if instead of, I mean, because the other thing, and I mean, you can speak to this probably better than me, Karen, is that when you have cancer and people are asking you to come hither and thither, and sometimes it's just to give a vial of blood. It's like, can you come get that from my house?
And that was my next question. That was my next question because you segued into the decentralized, and it's like, is that a viable answer to some of the barriers like childcare, affordability, transportation, time off, mental health, isolation, fear of participating because I'm undocumented, underinsured, not insured? These are the barriers. And when I remember sitting on a steering committee and being the only patient, and it's amongst doctors, and the I was told that a lot of the things that patients need that would make it user friendly, for lack of a better word, is a site by site basis. It's all budgetary. But if you want, and this is for the researchers out there who are listening, if you want us to participate in trials, these are things that have to be thought about, barriers that actually have to be addressed at the very beginning, not when you're trying to recruit and the site is already set up. Why not start talking about childcare, affordability, transportation, time off, mental health, all fear of isolation, fear of being reported, all of these things. Why can't these conversations be had at the beginning when you're forming the trial, and best practices, instead of putting the onus on the patient to try to figure it out and advocates trying to help them figure it out? That's
I
yeah.
100% decentralizing and remote participation, but I think that everybody, I think so. There's a couple of things, you know, um, for all the good that they do, pharmaceutical companies are profit driven organizations. And so, yes, they want to make the most rigorous trial they can with a dime. And so it may cost more money, absolutely. And it may cost more training and time. But once they start to begin to build these avenues, then they can use them over and over again, just like they have been. So absolutely, it may cost more or different. And I don't know if it's really more, because if you don't have, if your blood is being drawn, I mean, there's already phlebotomists that go to different places already.
Mm-hmm.
There's already phlebotomists that go to like some um some aging facilities and
Yeah.
aging even
Mm-hmm.
community, not just facilities but communities where
Right.
aging live. They're like, hey, we'll come get your, come
Mm-hmm.
either come to this meeting area or we'll come to your door. There's already people getting different drugs dispensed at home. There's already drug, pharmacists that go from door to door to give any kind of infusions, right? So there's already these things. It's just a matter of linking into these things and then using them for your test or your study and making sure that it follows protocol. So certainly what we want to know at the end of the day, we want to know that this drug is safe, effective for what it's being created for, and that it works in multiple populations or the populations that are at highest risk. That's one of the biggest challenges. If we've created, we see drugs that come out that the highest risk is among people of color, and their entire population of proof of concept, if you will, you know, they have 7%, 4% participants of the people who get the the issue, the cancer most. That's a
Mm-hmm.
problem. So I think that absolutely, I mean, this sounds probably very bad, but I don't really care if it costs the pharmaceuticals more money because it's helping them make a better drug. And you know, when these drugs then go to market, they're making billions with the B. Spend an extra couple 100,000 so that we know that it works and it's more effective. Because the more effective it is, the bigger the potential is that more people will be able to use it and make the money. So yeah, it may cost a little more. I just don't know that that's not my concern.
We need more people like you on the steering committees. And so I want to segue to the whole education piece because I feel like there was a lot of education going on when you were talking. And I feel like, is the onus on the community or is it a dual partnership when it comes to education in regards to like understanding, you know, what is actually out there? I can remember talking when Nav and I were putting together Karen's Club, and we had a conversation with a community member, and we were just talking about the COVID vaccine. And there was no, the member indicated that they hadn't had any information in regards to the COVID vaccine. We were the epicenter at one point. There was no conversation about it with their care provider, the medical care provider. They had gone to the hospital. They were part of a support group. There was no talk about clinical trials. They were in a high category of risk. There was no talk about, you know, clinical trials, the vaccine for the clinical trial. But yet and still, we had a public hospital in New York City that was doing the trials, and they were giving out, you know, the life-saving cocktail that some of the, you know, very, you know, the former president and the former governor of New Jersey and the former mayor of New York City got. And when I asked, you know, well, why didn't we know about it? It was out in Queens, like, you know, it was Latino, it was Africans. Like, why wasn't this, you know, we were shouting this from the roofs and the question went unanswered.
So I know many people. I oddly enough, I know quite a few people who actually participated in the trial, but it was very catch as catch can. And I don't want to. I don't know what the protocol was. I know that they did try to put a little bit more intention on actually testing it in minority populations. I just don't know how. I don't. Yeah, I don't know that they were going to the epicenters because I mean I'm guessing like I know once you've had COVID, then you have to wait until you no longer have the antibodies to be able to get the vaccination.
Right.
So maybe if at that time, and this is maybe this ain't me, you know, maybe they were
I
saying if you go to
understand.
the
I understand.
epicenter, then there's too many people who will have that positive who
Uh,
won't. But I will say that and actually the the um the COVID vaccination had a far more diverse population than
it
normal.
did. It did. It was
So
up in, I think, the 10 percentile
yeah,
for minorities that participated. But
but
my question is the education piece. I'm going back to the education piece in regards to, is the onus on the community? Is it that we need to do a better job of educating ourselves, or that we have to partner up with big pharma and researchers and really start really digging in hard? Because like I said, we are
I
diagnosed
think it's both
in
ends.
advanced stages most of the time. We lead the category minorities when it
Well,
comes to
and
death.
that's complex in itself. So one, I think the onus of knowing your body and knowing what's going on is absolutely the responsibility of the person who's living in that body. So knowing your body, knowing what may be okay and what may be going wrong and being sensitive to that is absolutely yours. Finding out about something and getting your question, that's one, asking the doctors. Yes, I mean the internet is it's a double-edged axe, right? It's a
Yes,
double
Dr.
axe.
Google.
So it can give you some good information. It can also just freak you out. And so you have to be able to kind of navigate that. And also ask your friends. Like I remember I know my father and both of his brothers and my grandfather all had prostate cancer.
Mm.
None of them, my grandfather actually, experienced it and died from the treatment. But my uncles, my dad and my uncles, they all had it. They never sat down and talked about it. So, so who know, I don't know who got it first, but nobody said, hey, well, here are my symptoms. So be aware. So part of it is really, you know, and I mean, because a lot of cancers, I tell people all the time, remember, MD Anderson used to be, when MD Anderson, you know, the big cancer, you know, treatment center in Texas, it started out for cancer and the criminally insane.
Mm.
So there is a stigma about cancer, and there's a stigma about, you know, certain kinds of cancers. There's all kinds of misnomers. If you have some kind of, you know, if you have some kind of reproductive cancer, then is there a commentary on who you are as a man, as a woman, as a
Mm.
being? You
Mm.
know, if you have colon cancer, I remember, I think it
Mhm.
was Jane Fonda that got it, and then that, you know, it was, oh well, it's because she enjoyed anal sex. First of all, she did great, that's her business, but that
Right,
doesn't mean that it
right,
was the cancer. But like, there's
right.
so many stigmas around cancers. You know, if you have breast cancer, does it make you something less than, different than a woman? Um, so I think that, you know, one, cancer needs to be discussed as often and as open
Okay.
as possibly it can be. So it's not this stigmatizing thing. A lot of times when people are diagnosed with cancer, they do feel very isolated. What,
Yes.
and they almost feel guilty. What have I done to myself to get this here? So part of it is internal. You have to be willing to put yourself out on Front Street and be kind of, be willing to be vulnerable in that way. The other way is, yes, I think that the healthcare systems need to be willing to have open discussions, and, you know, both. And one of the things that our healthcare system struggles with is the real idea of prevention, right? So we're great. Oh, you have symptoms. Now we can treat you. We're better at that. But, you know, talking before you have symptoms is a challenge. You know, teaching, hey, you know, here's some things that may increase your chances of cancer. Here's some things you can do different, and also clearing them up. I have a family member who's like, I don't eat grilled food.
Hmm.
And it's like, okay, but you do know that when they say that, they mean charcoal grill food, right? Not
Mm.
right, not just
Right.
any real food, right?
But that's
Or
education. That's
right,
education.
right. And so, you know, part of it is that it's kind of like, okay. And I mean, I'll tell you the truth. My family members are old. I don't fight with her on it. If that's what she wants to do, I just kind of let her go with it. Okay, you don't eat grilled food. We'll make you this, you know, hamburger in a pan, whatever.
Oh.
But I mean, like, you have to like it's sometimes it's harder to talk to the aging generation, and I mean, but I also think it's really really key to teach our children to know their bodies and ask questions. Like,
Speaking of speaking of questions, this question is just staring at me, and I'm thinking about it. I'm thinking about it, and I didn't want to wait to the question sessions, the questions from the viewers, to ask it. So I'm going to ask it now. I'm going to ask it a little
okay.
early because it's often asked. How, and you're alluding to it. How do you advocate on behalf of a loved one? Like, I know I have my answer, but that's often asked, and I think you're alluding to it, and you were
Well,
starting to talk about it.
it
So,
is. It's a number of things. First, is your loved one willing for you to advocate for them?
so that's a separate issue because if the person doesn't want you to advocate for them, you have to be willing to go,
To
okay,
respect their decision.
okay, okay, all right. I'm
Yeah,
glad
I
you
mean,
brought
and
that
it's
up.
hard.
Okay,
You
I'm
have
glad
to
you
be
brought
like,
that
all
up.
right, you know, but if they're willing to advocate, if they're willing to let you advocate for them, then you go to the doctor. Then if you can, you go to healthcare visits with them. You take notes for them. Because like I'm telling you, when you have, I mean, I've had cancer as well. You know, when you have cancer,
Mm,
you ain't firing on all cylinders
no,
on a
no.
mental capacity. That's just not where you are. So you have to be able to, so like it's great if you have somebody in the room who could take the notes that you kind of missed so that you can think about it more clearly. So going by what kind of advocate they want to be, I mean, I can tell you, um, you can go to a doctor and be like, hold on a second, I got a call. You need to talk to this person. Not when I had cancer, but when I had a broken ankle, I had a family member who is an orthopedic surgeon. And I was like, here, doctor, talk to my orthopedic surgeon relative. They're going to ask you some questions. And then he gave me, and then instead of the x-rays staying at the office, I took the x-rays home. You know why? Because I scanned them in and sent them a picture of them to my family member to look at. So sometimes that's what you got to do. Like, no, 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 I'm taking I have all of my medical records. You give me my medical records. And it's not from, I'm not saying I understand every bit of them, but I can take them to somebody else who does. So it really goes by how and where. And so like, um, I also like, when we fill out that who can find out about your health care, you have to be able to list. That's what I mean by do they want you to be advocate? Because they can only know as much as you give them permission to know because of HIPAA.
Right.
So you have to, there's always a form that you fill out that was like, who should we call in case of emergency? And there's also a form you fill out that says, who do you want to know about your health outcomes? Usually people put, if they're at one type of doctor, they might put their general practitioner. You can also put a family member so that they are informed of your health outcome, your labs and all of that as well.
I think it's a commendable job when someone wants to do that. So for those who want to do that, I say thank you on your family's behalf because it's not an easy job. And sometimes it's a thankless job. It's a hard job. But it's an important piece to be a caregiver and an advocate for someone who's been diagnosed and who's trying to manage a cancer diagnosis. When I think about answering the question, in addition to what Dr. Shegog said, I also think that we have to be kind to ourselves and ask for the help. Like, I think in our community sometimes we refuse to ask for help. We feel like we can deal with it all. We feel like we've got this. And there are so many organizations out there that's what they do. That's what they're there for. They're there to help you navigate, whether it's patient navigation, whether it's clinical trial navigation, whether it's, trying to find money to pay your bills or travel to get to a site. They're just, if it's mental health, your local social worker, support groups, there are so many different organizations out there. And so, because a lot of people ask me, oh, Karen, you did what you did and there should be more people like you, but not everybody, it's not, I wouldn't want anybody to go the road that I did by myself. Yeah, it was successful, but that's not something that everybody is built for and they shouldn't have to be. So my advice is definitely seek support and go to karensclub.org if you want to have a conversation. But there are so many other organizations out there and I feel like it's important that people feel like they don't have to walk this walk alone. They don't have to do it. So.
And you know what? If you don't have somebody, I'm really blessed. I have plenty of people in the healthcare, but if not, guess what? You know what? When another one of my family members had cancer, God bless the doctor, but we had family calls. We would get 20, 30 people up on the line, and the doctor would tell us where my aunt's cancer, what her progress was, what is her prognosis, and then she was just there to ask questions. And then she would only be on the phone for about 30 minutes. And then the family could kind of put our arms around our aunt, even if it was, and this was before COVID, but we were just dispersed across the country. We would have these conversations about, hey, auntie, this is what, I know, this is what I experienced. So we could be a support even when we couldn't. So, sometimes people think, oh, well, she's sick, I won't call. No, call, reach out. And, maybe sometimes being that advocate is really just being that support person. How you doing today? Do you have food? Let me send you some groceries. Now we have great things that can send groceries across the country, right?
Right.
Let me send you some groceries.
That's right.
Oh, today's the day where where you can finally eat. I'm gonna have food delivered. I'm gonna have a meal delivered to your house. There's many ways that we can support those who are experiencing cancer, and it's not just always being the one to go to the doctor with them, because some of us aren't suited for that any better than the person themselves.
Correct. That is so
if
correct.
not, but there's, let me drop this casserole off. Well, please don't drop a casserole at my house. I hate casserole. But, let me drop this food off at your house. Let me, stop by and give you a word. Let me, have this delivered. Let me give you an Alexa so you don't have to think so hard. And let me put your schedule into your Alexa for you, Like when I wake up in the morning, when I turn off and I don't know how I did it. So when I have to get a new phone, it'll be tragic. But my phone tells me, here's the things you have on your calendar today. How great is that? So I get that reminder. So there's things that you can do, especially with your elders. With my mom, we have a one of those platforms set up in my mom's house so we can drop in and get an eye on her. One day I called her, I couldn't reach her.
Mm.
She had not, her cell phone was dead and her home phone, she hadn't hung up properly. So
Mm.
so I was concerned. So we set it up. So now I can drop in and look at her and be like, you okay? So there's things that you can do other than being the advocate. Because really, when somebody's experiencing cancer, there's not a way that they don't need support. Every way do they need support.
I think that's so well said. Thank
No,
you.
I'm sorry. Thank you so much, both. And I hate to cut you off. This was really amazing. I did want to make sure we got to some of the great questions, which I think Karen and Maria, you actually got to some of them already, which is awesome. But there are a few great ones that will pitch in here. You just predicted them, or you were really savvy on the chat. This is a really good one that came in actually before the webinar even began. And I think you touched on it a little bit, but I think we can dig in further. What can research sites do to help patients overcome social barriers? What type of outreach or messaging would be most helpful in making patients feel more comfortable or want to learn
Mm.
I think one is that it has to be at a reading level and a reading level and a reading level that people understand. In public health, we say we don't do anything above a third grade reading level. So that's one. If you give somebody a bunch of words and it doesn't make sense to them or they don't understand it, it's not helpful. So that's number one. Two, it's more than just to give them a piece of paper, right? It is really having the conversation and saying this is because, people still think chemotherapy, hair fall out, you know,
Right.
50 pounds, I'm gonna
Mm-hmm.
lose 150 pounds, whatever. That's people not knowing that the variety of treatments and even the ones that are in trials are so wide beyond that, laser, all these different things. So I think it's really about one being willing to have that discussion. Um, ask the question. It's unfortunately where we are now in our healthcare system. It's about asking questions and
Mm-hmm.
then seeking answers. You kind of have to go to both. You can't, like because sometimes your immediate physician may not be up to date. Your general practitioner may not be up to date on everything that's going on in your specific cancer. So that's when you have to go and go somewhere else to get your questions answered.
I think to add on to what Dr. Shegog said, because I think that was a great answer. I think just at the very beginning, when you're, putting these, sites and clinical trials together, just think about what the patient's needs are. Talk to the community, whether it's childcare, reimbursement for parking, mental health, having a designated mental health person. I can remember I had somebody who actually would massage my feet as I was getting my infusion. I had somebody I could talk to about my bills. I had a clinical coordinator who would give me my schedule every week. It was just those things, those little things that made it easier for me not, because it's like you already are trying to manage something that's emotional, your life is on the line, and you don't need another pile of to do to have to worry about. So just really thinking from the patient's perspective about what would help them be able to participate and how can you do that? How can you meet them where they're at? So that's just what, just for any researchers out there who are putting to site who happen to be here. Yeah.
Yeah, I mean, that's actually a really good point. Simplify. I believe in the KISS rule. Keep it simple, stupid, right? So it's like keep it simple. If, like you said, every week they gave you a schedule.
Yep.
Um, and then absolutely find out what are the things that keep people from participating. I can tell you in our research, we found a plethora of things, some surprising, some not so much, but making sure that you attend to those. I mean, one of the things that we found is that sometimes people don't participate in trials because it's a tank of gas.
Yes. Talk about
Or in California, they have some really interesting parking law stuff going on. So it can be almost like $80 to park,
it. That's a
right?
lot of money. That's a lot of money. If you have
That's
to
a
go
lot of
every
money,
day, if you have to go
right?
every day, if you're in a phase 1 trial, that's a lot of money.
Right. That's a lot of money. So there is definitely like those are the things that that have to be explored and simplified, and also like and I think that's once again just simplified and think about those things that keep you from not participating, but also addressing being ready for some of them.
Yeah.
And also having people who look, I think I will speak for myself. I feel like when I see somebody who looks like me, there's already a sense of community caveat that comes along with that until they prove me wrong or right, right?
Mm.
So I think making sure that we have cultural, linguistic people prepared to talk to these people. So whether, so if they are Spanish is their first language, or Chinese, whatever it is, have people who can speak to them in their language if that's what they want. Out here, Filipino is big, whatever it is, Tagalog, have somebody ready to be. And if you don't have somebody ready, have a translation service ready so that you can speak to them in their language to remove any barriers that are linguistically associated. And then, know basic cultures. Know that, maybe I know that in many Asian cultures, looking Asian and many African cultures, actually, looking somebody you can consider an elder directly in the eye is a form of disrespect.
Mm.
So realize that, and say, no, 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 make sure that they're hearing you, but they may not be looking you directly in the eye. So be aware of that's by cultural intelligence. Be aware if you can't, if you're not familiar with the culture, be willing to learn and act with inside that. So that when we are going into the community, it's like somebody going to church and bringing their dog to many Southern Baptist church. Like that's not going to work. That's just Black folks don't take their pets to church. So, you just have to be aware of the cultural forays that can create bigger chasms or smaller chasms. You just got to go with that.
Um, Thank you so much for that, both Karen and Maria. I have another question here. So someone specifically looking for prostate cancer and bladder health clinical trials, any suggestions?
Um, if they want to know what trials are eligible, certainly they could go to our website. There is a patient information form that they could fill out, and somebody will follow up with them, and they can find out exactly what trials are there. Not only what trials are out there, but which ones they may be eligible for. And our website it's spelled lazarx.org.
Fantastic.
Right.
Fantastic.
Awesome. And then I think just to end,
And I spelled that wrong. It's Lazerx. Sorry, I'm gonna spell it. I'm gonna put it in.
Right.
I'll put it in the chat so people don't have to depend on my poor spelling.
excellent. Just wanted to end, hopefully on a somewhat optimistic note. And again, I think you both pulled on this thread a little bit, but as patients and caregivers, of which we have many in this room, how can we start overcoming the barriers we've been talking about? What are some first steps?
I think being kind to yourself. I think a lot of times we're so hard on ourselves. Why and why did this happen to me, or anger. I mean, and those are all real things and they should not be ignored. And it's not right, it's not wrong. I'm just saying that be kind to yourself and definitely find your tribe. So, whatever cancer it is that you have, find the organization that has experience and depth and advocates that can help you move along the path, because you don't want to do it alone. There are just too many pitfalls, too many obstacles. It's so emotional. And like Dr. Shegog said, being diagnosed, a lot of times you're not even hearing or retaining the information that you're getting. So finding your tribe, finding that particular organization, those advocates who, like Karen's Club, like Lazarex, like, so many others, that are doing the work and are there for you so that you don't have to do it alone. So I think the very first thing is to be kind to yourself, center yourself, and then just definitely find the advocates that are particular to your cancer that you have. And then, you'll get a little more confident in regards to being able to understand what's actually happening. Because I can remember not understanding what triple negative was at all. I didn't even understand that it was a thing, that there was different breast cancers. And it took me a while to be able to go through all the research and to be able to understand it. And so, like I said, I can remember being in a support group. I can remember having that mental health piece was really important. Because a lot of times, unless you've had cancer, I mean, the caregivers, your family, they want to do the best by you, but it's just hard for them to cope. And sometimes it's hard for them to understand. So even just going to see somebody and talking to somebody about what is actually going on, because it's really difficult to deal with, having that mental health piece, finding those advocates that are specific to your cancer. I think you should start there.
I think the first thing is to breathe. And the second thing is to actually understand what is happening. So, and it may be that you have to return to your doctor. What is my diagnosis? What does that mean? Can you write it down on a piece of paper and do what you need to know so you know what is happening? So before you can before you can make a plan of attack or of addressing what's going on, you have to know what's going on. And that's probably one of the hardest things, because I can tell you, when I heard cancer, and then I didn't hear anything else. It was just roaring in my ears after that. And then I had to go back and filter through my own to figure out what was going on. And so, first things first, understand what's going on in your body. And then also always ask the question, what can I do? Is there anything I can do to stop it? Because a lot of times what you find out is once the cancer presents itself, there's nothing you can do. So I know when I got diagnosed with cancer, I was kind of like, well, if I do this, it's going to make it worse. If I do this, it's going to make it spread. And it just made me very, like, I was probably more reclusive, because I was afraid that anything I was going to do was going to make my cancer worse. So by understanding what I had and what it meant across all of my lifestyle choices, it helped me be able to then say, okay, now how can I manage it? And so I would say first, find out what's going on. As Karen has said repeatedly, educate yourself on what it means, and then make sure you find your tribe. You go to the people and the places who can support you to navigate through the challenge.
This has been fabulous. I don't think I could have found a more honorable, humble, truthful, honest person to do this with today.
Well, thank you
so much for taking your time out of your busy
schedule. I can't believe it's been an hour.
I know, that went by really quickly. Thank you so much, Dr. Shegog, for blessing us with your knowledge and our space today. Thank you for everybody who came. Thank you, Tia. Thank you, Nava. And if you have any questions, the webinar will actually be up on karensclub.org, so you can take a look at it if you have any questions and you want to take a look at it again. And if you want to, have a one-on-one consultation with a patient advocate of color about clinical trials, you can go on karensclub.org and set up a consultation. That's it. Number